Hi, welcome to the ID Waiver Renewal Day Services Training, April 23rd, 2015. The intent of this training is to go over new changes based on the ID Waiver Renewal that affect day services. The ID Waiver Renewal was submitted in 2014. During that time, CMS released its Home and Community-Based Services Settings Final Rule. In that final rule, CMS indicated several areas in which the states needed to ensure compliance. The largest piece of that is ensuring that people are receiving services in the most integrated setting and accessing the community, the general community, as anyone else would. Part of what the division did to ensure that our providers were meeting the standard was to ask for a site self-assessment. All of our day habilitation and residential providers completed a site analysis on each one of their sites, and based on responses, we have asked for plans of correction. One of the largest barriers to individualized service planning has been the per diem services in the old waiver. Based on subcommittee meetings, stakeholder meetings, and work groups, it has been recommended and was recommended that day services be changed from a per diem to an hourly unit. We put that change into the waiver. However, Medicaid is not able to create an hourly service. This is due to national code standards. What we do have is a 15-minute unit. What you'll find in the waiver renewal is 15-minute services for nearly everything except for residential habilitation. Residential habilitation will continue to be a per diem service. Since there were so many significant changes in the ID waiver renewal, the division thought that we would phase in the services. The first most important piece of the change is to ensure that day services get converted. It's the most difficult and it impacts the most people. Future webinars will go over supported employment, new waiver services, and self-directed services. Full implementation and rollout of the new ID waiver should be implemented October 1, 2015, fiscal year 16. So what has changed? Day habilitation units have changed. Pre-vocational service units have changed. Pre-vocational services definition has changed. Supported employment per diem units, supported employment per diem name and definition have changed. And we will no longer use the partial day habilitation unit or service. If you remember, the partial day habilitation service was designed to help augment someone's day if they were in a competitive integrated job in the community. This service will no longer exist. The regular day habilitation services can be used to augment someone's day if it's necessary and if it's in the individualized person-centered plan. The ID waiver renewal rollout. The ID waiver renewal has been approved by CMS and is now in effect. The Division of DD will use a phase-in approach to implement the ID Waiver Renewal. The first phase will be updating day habilitation, pre-vocational services, and supported employment per diem. The next phase will be training and go live with new services and service definitions beginning fiscal year 16. The final phase will be utilizing new services in conjunction with the person-centered planning based on personal outcome measures results. Per CMS guidelines, the person-centered plan approach identifies the person's strengths, goals, preferences, needs, medical and community-based, and desired outcomes. The role of the agency worker, counselors, support brokers, etc., in the person-centered planning process is to enable and assist people to identify and access a unique mix of paid and unpaid services to meet their needs and provide support during the planning. The person's goals and preferences in areas such as recreation, transportation, friends, therapies, home, employment, family relationships, and treatments are part of a written plan that is consistent with the person's needs and desires. CMS has made it very clear that each person will have an individualized service plan. In order to accommodate the flexibility, we have had to make some updates to our waiver. Day services per diem will no longer be per diem. They will be 15-minute units. This chart is an example of the changes. The new service codes are not official. This is just for the purpose of training. Medicaid is in process of developing new service codes for us. Once those are in and into our system, then we can send out notification to all case managers that the service codes are now available in Adidas. So not only are there changes happening internally in terms of waiver renewal, but we also have to ensure that our Adidas system is up to date so that plans of care can be updated and authorizations can match your plans of care. Day habilitation services. In order to help individualize the planning, the day habilitation waiver service will now be planned and authorized for a 15-minute unit and no longer offered as a per diem service. To roll out this service change, we are asking that case managers revise current plans of care for all individuals receiving day habilitation, including partial day habilitation. Starting May 1st through June 30th, the time frame for revising the plans of care, the RFA process will not be used for this process. Simply make the necessary revisions on the plan of care, obtain signatures, and submit to the Regional Community Services Office. Again, starting May 1st through June 30th, plans of care that have day habilitation services, including partial day habilitation, will need to be updated. The conversion from per diem to 15-minute unit will be based on a 5-hour day. 5 hours equals 20 15-minute units. Regional Community Services will ensure that authorizations are updated. From July 1st through July 31st, providers will be asked to hold July services billing. The division is asking providers to track utilization for fiscal 16 prior to us authorizing more units in a day. So what we have here is a rollout from May 1st to June 30th where case managers will update the plans of care. You will convert your existing per diem to the 15-minute unit. We will not authorize anything beyond the 5 hours that's already authorized this year. The Regional Community Services Office will receive your information and they will ensure that authorizations are updated. Again, the RFA process will not be used. From July 1st through July 31st, fiscal managers will be updating authorizations. Providers will need to hold their July billing. Another waiver service that has changed from per diem to 15-minute unit is pre-vocational services. Just like day habilitation, the same rollout will be used. To roll out this service, we are asking case managers to revise the current plans of care for all individuals receiving pre-vocational services. Again, May 1st through June 30th will be the time frame for revising plans of care. The RFA process will not be used. The conversion from per diem to 15-minute unit will be based on 5 hours. The regional community services will ensure that authorizations are updated. From July 1st through the 31st, providers will be asked to hold services, billing for services for July. The division is asking providers to track utilization for fiscal 16 prior to us authorizing more units. So again, just like day habilitation, the plan of care will reflect a 5-hour day. It will just be a 15-minute unit. Another change to pre-vocational service is the definition. This is based on the CMS core definition requirement. This is just an excerpt of the actual service definition. If you want to know the complete definition of the service, please refer to the service guide on the department's website. Services under the waiver are designed to create a path to integrated community-based employment for which an individual is compensated at or above the minimum wage, but no less than customary wage and level of benefits paid by the employer for same or similar work performed by individuals without disabilities. Services include teaching concepts of attendance, task completion, problem solving, interpersonal relations, and safety, as outlined in the individual's person-centered plan. Pre-vocational services provide learning and work experience, including volunteer work, where the individual can develop general, non-job, task-specific strengths and skills that contribute to the employability in paid employment in integrated community settings. Services are expected to occur over a 2-year period, with employment, integrated and competitive salary, being the specific outcome. It is the expectation that after 2 years, a referral will be made to Alabama Vocational Rehab Services to begin the Milestones program for job placement and short-term follow-up for the individual who utilizes employment service options. If after 2 years a person has not been referred to VR or moved into other waiver services, the provider must justify continuing this service to the Central Office Supported Employment Coordinator. So what this says is that CMS has an expectation that pre-vocational services are general in their habilitation training. They are focused on soft skills, teaching concepts, attendance, task completion, problem solving. They are not intended for the waiver participant to work on third-party contracts at piecemeal rates. Pre-vocational services does allow for wages under minimum wage while they are receiving training. The VR referral at the end of the 2 years is the bottom base of what's the expectation. We would hope that people in pre-vocational services are on their way to being employed. If someone is receiving pre-vocational services, it's because they are very close, if not able, to be employed, integrated, and in the community with limited supports. We would expect that most people would move from pre-vocational services to the VR process sooner than 2 years. CMS requires pre-vocational services to be time limited. Alabama has chose to allow for an extension of our time limitation through documentation and justification. Again, pre-vocational services should lead to employment. They are time limited. They are task oriented in terms of task completion, problem solving, interpersonal relations, and safety, etc. It is expected that pre-vocational services within the person-centered plan, the person has a pathway to employment, which means there are outlined activities for this person that will lead to employment. So to recap this, pre-vocational services is time limited. It should be focused on soft skills such as teaching concepts of attendance, appropriate problem solving, relationships and safety on the job, and in general. Pre-vocational services should lead to individualized employment. There should be a path to employment plan within the person-centered plan. And at the very minimum, the expectation after 2 years is that someone receiving VR or pre-vocational services would be referred to VR to start the milestones process. Now, it's not required that someone spend 2 years in pre-vocational services prior to being referred to VR. It's the longest that we would want to see someone in pre-vocational services without having a referral to VR. Supported employment small group, it's a per diem service. In order to help individualize the plans of care, we have also changed our small work group to a 15-minute unit. Again, starting May 1st through June 30th, plans of care will be revised. The RFA process will not be used. Simply make necessary revisions to the plan of care, obtain signatures, and submit to the regional office. The conversion from per diem to 15-minute unit will be based on a 5-hour day. 5 hours equals 20 15-minute units. Regional Community Services will ensure that authorizations are updated. From July 1st through July 31st, providers will be asked to hold July services billing while the fiscal managers update authorizations. Again, we'll be asking for providers to track utilization for fiscal 16 prior to us authorizing units that exceed the 5-hour day. Employment support small group definition. Supported employment per diem no longer exists. Since 2009, when CMS came out with new service definitions for employment that included individualized employment, such as our job coach, and small group employment, which we were using a general supported employment service per diem, we have made incremental changes to the waiver. In 2009, the waiver was amended to add job coach and job developer. Additionally, the waiver was updated to make supported employment a small group. So the supported employment per diem became a small group. We further made a change to employment services, supported employment services, through this new renewal. The new title for the service is Employment Support Small Group. You will no longer see supported employment. Employment Small Group definition. Employment Small Group are services and training activities provided in a regular business, industry, and community settings for groups of 2 to 8 workers with disabilities. Examples include mobile crews and other business-based work groups employing small groups of workers. Employment small group services must be provided in a manner that promotes integration into the workplace and interaction between participants and people without disabilities. The outcome of this service is sustained paid employment and work experience, leading to further career development and community-based individual employment for which the compensation is at or above minimum wage. Employment small group, both individual and group, employment supports both group and individual services do not include facility-based or other similar type vocational services furnished in specialized facilities that are not part of the general workplace. Both services must be provided in integrated settings and paid at or above minimum wage. Supported employment for small group. This definition is, or employment supports for small group definition comes straight from the CMS guidelines. It is the core definition of small group support. The big change that is in this definition that's not in our old waiver is the fact that the outcome to small group employment is individualized employment. So just as pre-vocational services is time limited, CMS wants to ensure that people receiving small group services for employment have a plan, a pathway to employment, and a way to move from a group setting to individualized employment. So again, this service really is time limited, although we did not put a time limit on this service. The expectation is that a person utilizing this service will have within their person-centered plan activities related to career development and the movement toward independent, individualized jobs in the community. This takes us to revising the plan of care in Adidas. Now that you understand the changes to day services that impact the most people, we will go over how to update the plan of care in Adidas. What you see now on your screen is an example of an existing plan of care. I have ensured that no individual data is being shown, but what you can see is that this particular waiver has day habilitation level 3, 1 unit per business day shown with start and end dates for the plan period. In order to begin the process of updating the plan of care, you would go to the person's record in ADIDAS, you would go to Plan Services, and you would go directly to the link that needs to be updated, whether it be day habilitation, pre-vocational services, or supported employment per diem small group. Once that link is clicked, you will go into the details of the plan services. The most important thing here is the end date and the conversion from per diem to 15-minute unit. No matter what your service plan dates are, start date to end date, all day habilitation, pre-vocational services, and supported employment per diem need to be ended 6/30/2015. That's June 30th, 2015. And the action code would be terminate. So we are going to terminate this service. And there's really nothing that needs to be done any further down. There's no conversion of units at this point. So the most important thing here is going to be your end date. That is the most critical piece. Once you've saved that change, the next step is to go in and add a new service line to the plan services. This new service line will start July 1st. 2015. Service ID should be included. Note that this particular service ID that I'm using in this presentation is not official. We are still waiting on Medicaid to return official service codes. This is used as a placeholder for our training. The next step The next step is to convert or to change your units. When you go down to unit type, rather than clicking down and using the per diem, you will use the 15-minute increment. You will enter 20 for the units per, and you will enter the business day. Now, if you have someone planned for 3 days a week for day habilitation, 2 days a week, a couple of days a month, or you've got some partial day habilitation, you may have to use a different calculation. You may have to set this up a little different. But if you have someone that is set up to receive day habilitation services each day of the week for the month, then you would convert it using the typical business day. And then the rest is what normally takes place when you set up a planned service. You're going to identify the provider. The unit cost will automatically default. This is the correct unit cost. The amount will be populated, the number of units will be populated. And the last step was to add your funding source. Once those changes have been saved, you can go back to the person's record and you can click on the plan of care report and you should see a revised plan of care. You can see that this plan of care is no longer an initial plan, it is a revision number 1. And you can see where I have terminated, I should have terminated, sorry about that. The termination should have been at the day hab level 3, 1 per business day. And then the added action is the day hab level 3, 20 per business day. So there's just a little error in my slide here. The final step for the conversion is to get signatures of the waiver participant and witness, also the case manager, and the program QMRP. Since this conversion is simply changing units from a per diem to 15-minute unit, the whole team does not need to convene unless the person requests it or there seems to be a reason to have a full team meeting. That completes this training on day habilitation, pre-vocational services, and supported employment work group, small work group. If there are any questions after viewing the PowerPoint presentation and listening to the webinar, please submit your questions to the Regional Community Services offices. The waiver coordinators, the CSDs, and the fiscal managers should be able to address outstanding issues. However, if questions come up and we haven't thought through an individual scenario, we will certainly be looking together to work out any kind of individualized problem. We feel like this should be mostly a smooth process, but everybody has individualized issues at some point, so please feel free to contact your regional office with questions if we did not cover it in this meeting. Thank you, and I will look forward to having a few more webinars to discuss our waiver renewal changes.